Randomized controlled trial for vestibular treatment in concussion. Via clinical trials. Conditions: vestibular disorder, mild traumatic brain injury. Intervention: behavioral, T-REV. Sponsors: University of Pittsburgh, United States Department of Defense. Not yet recruiting. Ad tags: currently, ORL, medicine by Alexandros G. Sfakianakis. A prospective, single-blind, four-group multi-center randomized controlled trial, RCT, of targeted rehabilitation exercises for vestibular symptoms and impairments, T-REV, in civilians with mild traumatic brain injury, mTBI, will be conducted at the University of Pittsburgh Medical Center Sports Medicine Concussion Program, UPitt. The 4 treatment groups will consist of the factorial combinations of low, 30%, and high, 70%, intensity of exercise crossed with low, 12 to 18 minutes, 1x/day, and high, 12 to 18 minutes, 2x/day, frequency. A total of 125 participants aged 18-40 years will be enrolled across years 1-4, with approximately 100 participants completing the whole study. After potential participants with mTBI are screened for the vestibular clinical profile, using domain-specific tests and measures, and enrolled into the study, participants will complete primary and secondary outcome measures and receive a home exercise program that A. targets participants' individual deficits, and B. is of the appropriate intensity and frequency for the participants' randomly assigned treatment group. Participants will return for in-clinic visits once per week to receive treatment and progress assigned exercises. Condition or disease intervention, treatment phase. Vestibular disorder. Mild traumatic brain injury. Behavioral, T-REV. During the past 17 years, U.S. military personnel experienced 305,000 mTBI, VVIC, 2017, with an estimated 65%, 187,000, involving some type of vestibular impairment, gaze, postural, dynamic instability, and symptoms, dizziness, vertigo, motion intolerance, Mucha et al., 2014. These vestibular impairments and symptoms, which have been associated with poor outcomes following mTBI including longer recovery times, Lau et al., 2011, can be actively treated using targeted vestibular rehabilitation exercises, Al-Salahin et al., 2010. In fact, the investigators recently concluded an observational trial of military personnel and civilians with mTBI targeted evaluation, action and monitoring of TBI, Team TBI, Project, W81XWH14-20002, supporting the effectiveness of targeted vestibular rehabilitation exercises in military personnel and civilians with complex mTBI, Condos et al., in Press. Although these vestibular-focused rehabilitation exercises are commonly used by military medical personnel following complex mTBI, there are no well-designed studies that show how much these exercises should be performed to be effective in U.S. military personnel. In short, the concussion rehabilitation field does not know how frequently or intensely the exercises should be performed in order for injured personnel to have the best recovery. In the current proposal, the investigators leverage our interdisciplinary team of experts from physical therapy, neurology, neuropsychology, and sports medicine and over 17 years of clinical and research experience to conduct a RCT comparing different frequency and intensity of targeted vestibular therapeutic exercises in military personnel and civilians. In so doing, the proposed study may inform a more precise approach for treating vestibular symptoms and impairments following mTBI that minimizes morbidity and accelerates recovery. Deliverables from the current study include: 1. Outcome data regarding the efficacy of different frequencies and intensities of targeted vestibular exercises in both military personnel and civilians, and 2. Evidence-based clinical practice guidelines, CPG, for prescribing vestibular therapeutic exercises.